I was working in the Netherlands as a psychologist for, I think, almost 5 years, and I just needed a new challenge, maybe a change of lifestyle, something new, and I started looking for opportunities outside of the Netherlands, and I found DARA online, and yeah, I applied for the job and came to visit DARA, and when I was here I was just blown away and decided to come to work here. I have my bachelor's and master's degree in clinical and health psychology, and after my master's I started working in a psychotrauma center, which was a center for people from all over the world, so refugees, but also for Dutch people suffering from post-traumatic stress disorder, PTSD. So it was mostly focused on trauma, that work. And after that I started working in a more general practice, so people suffering from anxiety, depression, burnout and so forth. I like working at DARA because it's such a holistic approach. I think our program tends to the body, mind and the soul. And we spend so much individual time with our clients. You see your clients every day, so you have a really deep connection with them. And yeah, we're in this beautiful nature resort. We're in the middle of a jungle and the ocean is also right at our side. So it's wonderful to work here. It's really, really beautiful. Well, I always knew that I wanted to become a psychologist. Psychology was always a very big passion of mine, to kind of discover the way people think and how it is connected to their behavior. And in my therapy I find it very, very important to feel a real connection with the client, because only then I think you can start changing things in therapy. And started working with trauma, I also noticed that the body and the mind is connected. So people who are traumatized also often show psychosomatic symptoms. So being a yoga teacher as well, I started incorporating yoga and mindfulness in the therapy, so using breathing techniques, also bodily movements, because when your body starts to change, your mind also starts to change, and I think vice versa as well. So incorporating body and mind in therapy is very, very important and very effective. Well, in therapy I mostly use CBT, which is cognitive behavioral therapy, also psychotherapy to get in more depth with a client. If it's a specific trauma, I would use exposure or EMDR, which is an acronym for eye movement desensitization and reprocessing. And this is a very, very quick and very effective therapy for specific traumas, and we see results very quickly with this one. And lastly, of course, I would use mindfulness, for example, mindfulness-based relapse prevention therapy, which is very important for addiction and addiction therapy. Well, if you're struggling with the idea of coming to a rehab, I would actually motivate you to try our DARA program. It's a very intense program, but we always tailor it to your individual needs. And actually the feedback we get from our clients is very positive. They gain insight into their personality, into their addiction, of why they are actually using and how it is affecting their lives. And we of course cannot guarantee your sobriety or that things will permanently change for you, but what we do know is that small things will change, and I think the small things really make a difference. Well, I live on this beautiful tropical island, so I go to the beach, I swim in the ocean, do snorkeling, jungle trekking, lots of yoga, and just relaxing and just enjoying the tropical vibe.